Hi and welcome everyone. Today's topic will be on concepts related to health. We will be covering health and wellness, illness and disease, the health illness continuum, and the health maintenance and promotion, and how nurses incorporate into all of this. So nurses collect data, diagnose human health problems, plan and provide care, and evaluate outcomes of care. Nurses educate clients, families, and even staff. Health and wellness. The health is defined as a state of complete physical, mental, and social well-being, and it is not considered the absence of disease. If a person is not functioning optimally in every way, they are considered not healthy. The nurses practice from the perspective of holism. Holism means viewing a person's health as a balance of body, mind, and spirit, and treating all three while giving specific treatment to the client. It is not merely treating the disease rather than treating the client as a whole, meaning that the nurses must consider the client's psychological, social culture, developmental, and spiritual needs. And in that way, you will be treating the client as a whole and not treating the disease itself. So, describes the state of being. It is an effort to stay healthy and achieve the highest potential for total well being. It requires lifestyle choices. This includes physical, occupational, environmental, spiritual, emotional, intellectual, in all these types of areas. The activities and the choices that the individual chooses, it is basically they choose it to promote their good health, meaning like physical self-care, prevent illness and injury, using their full intellectual potential. And they will get appropriate emotional response to these changes and behaviors in order to manage stress. Illness and disease. Illness refers to a state of being sick. So, illness may be viewed as sudden, traumatic, acute, chronic, or even terminal for those hospice care patients. Disease refers to a pathological condition of the body that presents with clinical signs and symptoms and changes in lab values. So, the major difference between illness and disease is that illness is highly individual and personal, whereas disease is something more definitive and measurable. The health illness continuum, it is it is a contrast of definitions of health and illness. It is kind of like a ladder where you have high level of wellness at the top of the ladder and you have death at the top of the ladder. And in between you have good health, normal health, illness, and critical illness. So the health illness continuum illustrates the process of change in which individuals face in life, ranging from extremely good health to death. So clients adapt physically, emotionally, and socially, enabling them to maintain comfort, stability, and the self expression within them. So, therefore, the clients with chronic illness can achieve a high level of wellness if they can experience a high quality of life within the limits of that illness. So, just because you are ill does not mean that you will not reach your highest level of wellness. You just have to work with the illness in order to reach your highest level of wellness and satisfaction in life. Health maintenance and promotion. So, health maintenance refers to protecting one's current level of health by preventing illness or deterioration. Um, this is something just as simple as taking your medications when you're supposed to, as they were prescribed to you by the physician, or being screened for diseases like colon cancer or breast cancer, or even something as simple as practicing safe sex. Health promotion refers to engaging in strategies to enhance health. For example, these things would include eating a healthy diet, eating a diet rich in high fiber, complex carbohydrates, low in fat, high in fruits and vegetables, exercising regularly, balancing work with leisure activities and family, and learning to balance your stress in your life. And there's very different techniques that you can try to reduce stress. Illness prevention involves identifying risk factors, such as family history, and reducing the effects of the factors that you have on yourself based on the family history. So, something that would be really important for somebody who has a family history of some type of disease and the risk factors associated to it, it's important to have early detection in their life and have like annual physicals and not annual screenings, but appropriately timed screenings, like such as mammograms and colonoscopies and having lab work done every year. All of this will help to detect a probable illness early on to help maintain it so it doesn't go to a bad category in the health illness continuum. So the client is an active partner in nursing care. So they are personally responsible for their own health, and they are the greatest at being responsible for their own health and meeting their requirements for health, such as health promotion and maintenance. And this all goes back to them. They no longer play a passive role. So they are actively participating in the treatment decisions regarding their own health so they can live their life in the high level wellness and the health illness continuum. So this is it for today. Thank you for watching, and don't forget to subscribe to show your support. Thank you so much.